What I'm going to do is we're going to give medication. So we're going to come to the med card. We've opened up the MAR so that we have the correct patient, and we're going to pull out of our medication. So out of our drawer, we're going to take out our ampule. The ampule is the first medication we're going to give. So we're going to compare the ampule to the patient's name, the medication, the dose, the route, and the time, which is in 2 places in this case. The expiration date on my ampule is good, so we know that we have the first of our 3 checks. The ampule may have medication that gets caught up into the top of the ampule, so we want all that medication down into the ampule. So to do that, we're just going to grab a hold of the ampule and we're going to shake it down. And as you can see, all the medication comes down into the ampule. So now we have to make sure that we have all of our equipment ready. So for the ampule, we need a straw, and it's a filtered straw, so that the filtered straw will catch any fragments of glass that is open from the ampule. So we have our filtered straw, and then we have a 3 ml syringe, and the date on our syringe is good. So all of our equipment is sterile and ready to go. We also have an appropriate needle, so that would be determined on how we're giving the medication. This is a 20 gauge 1-inch needle. We're going to open up our equipment here just so we have it ready. So I'll fold that back. And we're going to go ahead and open our ampule. So when I grab the ampule, if you notice I have an alcohol pad. On the alcohol pad, we're just going to fold it around the ampule. And to open the ampule, which is kind of a scary part of this process, we're going to break the glass. So I'm going to take my thumb and push my thumb forward and pull my fingers back. So as I do then, I'm going to do it away from everyone. So I pull back and it cracks off. And as you can see, the ampule cover is right there in the top. And I'm going to put that into the sharps container. And then I'm going to set the ampule down. And I'm going to get my syringe ready. So now I have my syringe open, and I'm going to open my filtered straw by folding each of the layers back, keeping the end of the straw sterile. That's the most important part. So we're going to take the syringe out, connect it to the straw, making sure I turn it tightly. And then here's your syringe. So on the syringe, what we're going to do is we're going to pull the plunger back to kind of loosen it up a little bit to make sure that it's not going to stick when I come to draw the medication out. So what we're going to do now is we're going to place the filtered straw into the ampule, and we want to make sure that we don't touch the sides of the ampule. So we're going to go into the ampule, come straight down, and now we're going to drop all the medication in the ampule. This is a one-time dose ampule, so I'll have all the medication out of the ampule. We're going to turn this over, and now we're going to adjust it so we get the dose correct. We're going to pull up on the plunger. As you can see, the air is coming out of the top of the filtered straw, and we're going to get our dose correct. So we're going to give a 1 ml. So once we get our dose correct and we get the air out of our ampule, we kind of tap the side of there to make sure that we have the ampule correct. So now, we cannot give the medication through the filtered straw, so we need to change that to an appropriate needle. So in this case, I'm going to go ahead now and open up this needle, keeping the end of the needle sterile. And we're going to turn this off, drop that, and now come to these together and twist tightly. Okay? So then we would have our medication filled appropriate for the ampule. All right, so the next one we're going to do is we're going to do a vial. So we would have checked our vial the 3rd time. This would have been the 3rd check with our vial to make sure that we still have the correct medication that we're drawing up. And once that vial is checked, then I could, or the ampule, then I could put the ampule in the sharps container because it is glass and we want to get rid of that. So we're going to go to the vial next. So we're going to go to our med drawer, pull out the appropriate medication for the vial. We're going to check this against the correct patient one more time. The correct medication, Rocephin, 1 gram is what we're going to pull out. We're going to give the injection IM, and we're going to do this at 8 o'clock in the morning. The expiration date on my vial is good. So that was our first check when we pulled it out of the drawer. And then our second check is to do that one more time. This is I'm a collector, who's our patient, Rocephin, 1 gram, IM, and the correct time frames to do that. So now we're going to get our pieces of our equipment ready for the injection. This time we're going to use a syringe that the needle is connected to the syringe. And it is a 3 milliliter needle, a 22 gauge, and a 1.5 inch length to that needle. So we're going to take our alcohol pad and we're going to clean the top of the vial. And in this case, we're going to clean it for 15 seconds. So 15 seconds is a pretty long period of time. So we're just going to make sure that that is nice and clean. All right. So we're going to open up our syringe. And because the needle is already connected to the syringe, we're going to make sure that it's on tightly. So I twisted, as you can see, I twisted to make sure that the needle was connected to the syringe tightly. Then I'm going to pull straight off, and that's what pulls the cap off of it. I'm going to go ahead now and loosen that plunger up. As you can see, it was a little sticky there, so I just loosened the plunger. When you go into a vial, you want to make sure that you're replacing the air into the vial. So in this case, we're going to draw up 1 ml of fluid. So I'm going to pull back on the syringe, and I'm going to pull back to 1 ml. And that's air that I have in there now. So now I'm going to take the needle and penetrate through the stopper. And I'm going to push the air that I have into my syringe into my vial. Now, I'm going to invert this, holding my thumb on the end of the plunger so that I can keep the air into the vial. So I'm holding this with one hand, and then I'm coming back with the plunger, and I'm pulling down on the plunger. I'm going to pull down on the plunger and get the medication into the vial. As you can see, there's some air in the bottom of the syringe, so I'm going to tap that air out. Couple of taps and it'll bring that out, and then we're going to push up to the appropriate, oh, there's still a bubble in there. There we go. We're going to push up onto that to get the appropriate dose. Okay, so once the dose is appropriate onto the amount that we're taking out, I'm going to take off the vial. Now, the important part with recapping this syringe, the syringe is a sterile syringe. I have not used it on a patient, so I can recap it because I need to take it from here to the patient. So I'm going to scoop the cap up, not touching the table. And once I get it scooped, then I'm going to bring it upright and push the cap down. So now this one is secure. All right. So we're just going to set that aside. I'm going to check for my last time with my Rocephin against my MAR. So here we are with the Rocephin again, and we have 1 gram IM. We're going to give it at 8 o'clock in the morning. So that would be our third check with that medication. The next type of medication I want to show you is a pre-filled syringe. So I have 2 pre-filled syringes that I'm going to pull out of the drawer. We would then again, just like we did before, check it against the MAR, making sure that we've checked this 3 times with the MAR. But the pre-filled syringes are nice because the fluid's already in the syringe, and there's a date on the side to tell us when the expiration date would be for this medication, which is here on the side. But we have to get this ready to be given to the patient. So there's 2 different type of holders that we can use to give the medication. So this first holder I have is called a Tubex. The Tubex is a little bit different design than the carpet jet. So I'm going to show you the Tubex first. The Tubex has a collar on the top which turns. So I'm going to have it in the open position. I'm going to place the syringe or the pre-filled syringe on top, and then I have to lock that. So I'm going to turn that tight, and that's going to hold it so it isn't going to move around. And then I need to do is, because now the plunger is loose, the plunger gets activated by screwing it into the end of the syringe. So once that gets tight on there, then I can go up and take the cover off, and I'm going to adjust the dose. So the dose of the medication, as you can see coming up, I'm going to make sure I have the air out, and then I would adjust the dose whatever would be the prescribed amount from the physician. So if I needed to expel some of the medication, I would do that over a sink so that we could expel to the appropriate amount of education or pound of medication. And I might even have to tap it a little bit to get the air bubbles up, just like we did before. If I was giving this in the IM injection, then I would go ahead and get my appropriate syringe or needle that I need. So I'm going to use this one, I think, for you. Here again, it is for an IM. This is a 20 gauge 1-inch needle. We're going to open the package like we did before, making sure that we keep that tip sterile. So that's the most important part, is that end remains sterile. We're going to go ahead and turn it on, and we're going to press it tight. And so now this would be ready to be given to the patient. So I'm just going to kind of fast forward for you a little bit, because I want to show you how to take this out of the holders, because the holders are reused, and after this medication would be given, so this would be the given medication, I want to reverse the process of how I started. So I'm going to take the plunger and unscrew it, so now it's loose. You can see it's loose in there. Then I'm going to take it in the collar, and I'm going to open the collar. I would lay this into the sharps, and it would go down into the sharps container. Okay, so that would be after it's been used. Now we're going to do the Carpujet, which is just another manufacturer of the holders for the pre-filled syringes. The Carpujets have two of the same parts, the plunger, but the locking system is a little different. This locking system turns to be able to secure it. So I pulled the plunger all the way back. I'm going to place the syringe into the holder. I'm going to lock it just like we did before. Turn to lock. We're going to secure the plunger. So now the plunger is on tight, and the process continues. So I would take the cap off, and I would adjust my dose so I can see that clearly. There's a little air bubble to the bottom, so we're just going to tap that up, and we're going to expel the medication. And the dose really depends what the physician orders, so that will be a lot of variables to do that. We would put on appropriate syringe or needle if we needed to, or we could give this an IV medication where I wouldn't need a needle on the end of that. So in this case, we're just going to cap it because there's no needle there, and take it into the patient, give the medication. So now when I come back, this would be a given medication. So we do the same process as we did before, but in reverse. So we undo the plunger, so you can see where that's unwinding. I pull it down and secure it into here. I unlock the medication, so now this should be loose into it, and then I would just tip it into the sharps container. Which, I don't know if this is gonna, there we go, into the sharps container, and off it would go. Okay, so now we're going to continue from the med room. We've already checked our medications. We know we have the correct medication, and we're going to go into the patient's room. So we're going to go in and give Luann her vaccine. Good morning.
Hi.
I'm Ann Rossblock, and I'm going to be your student nurse who is going to give your vaccine today.
Oh, okay.
Can you give me your name and your birthday?
Sure. My name is Luann Lonergan, and it's 4/5.
Okay, good. Have you had an injection before in the past?
Yep, I get a flu vaccine every year.
Okay, perfect. So what we're going to do is we're going to give you the injection into your deltoid muscle, which is your arm muscle.
Oh, okay.
Okay. So I'm going to put put your bed up a little bit so I have a comfortable position for myself.
Oh, okay.
And I would have looked at her to make sure that the deltoid was a good muscle. She has good muscle development in that area. So we're going to pull up. First, I'm going to put some gloves on. Good. So she's so nicely pulled up her sleeve for me. The first body part we're going to determine is the chromium process. So I'm going to feel at the end of her shoulder, and for that a chromium process. And for the proper placement, we're going to put the little finger on and come down 3 fingers below that. Right there is the deltoid muscle where we would give the injection. I do need an alcohol pad. So we're going to get the alcohol pad open and ready. I'm going to do the placement again below the third, and now we're going to clean in a circular motion about 2 inches out. So that's where it is. We need to let that dry, so that as that's drying, I'm going to make sure that my needle is on tight, and I'm going to pull that straight off. This needle, as you can see, has a safety device on it, and I'll show you how to activate that at the end. We're already drawn up. Leanne has got her arm in a relaxed position, and she's holding it tight. She is an adult, so she's going to hold still for me, and I don't need anyone to hold her to be able to do that. So in our case, we're going to use this little silver pad because I don't want to actually poke Leanne into the arm. So I've done my placement, I've cleaned my site, and we're ready to give the injection. So I'm going to secure her deltoid muscle by kind of grabbing hold of it a little bit, and we're going to do a darting motion. So the darting motion for the injection is just a straight dart. So Lynn, are you ready?
I'm ready.
All right, here we go. So we dart into the medication. Now I'm going to secure the syringe by holding on to it. I'm going to pull back, and I'm going to look for aspiration, so it's a little bit of a blood return. If I got a blood return at this point, I would have to stop and start the whole injection over. But because she has no blood return, we're going to give that injection. So we're going to give the injection at 10 seconds per milliliter. So it's a nice slow injection. It's going to burn a little bit, and it does. And once I give that injection, then I hold it in for additional 10 seconds so that the medication can start to absorb before we remove it. So once that's absorbed, I'm going to pull out and activate that safety device by just taking it on the edge of the table, folding it over, and clicking it. So now that is safe to set down. And I could take my alcohol pad or gauze and just hold it over the top of that injection site, and so that in case it was bleeding, so I could contain that, and then I could put a Band-Aid over the injection site for her so that she would have that all set.
I didn't feel a thing.
So now what I'd like to do for you is to landmark the other 2 positions that you would be giving your IM injection. And I showed you the deltoid, and that's about 2 inches down from the chromium process. So now what we're going to do is we're going to do the vastus lateralis. So for the vastus lateralis, I need to find 2 body marks on her. And the first is the patella. And so we're going to do the lateral aspect of the patella with my right hand. And then my left hand is going to find the head of her trochanter. And usually it is about right into the groin line. That'll help you find the landmark. Pretty easy to find on Luann. It's right here. Here's the top of her patella. So then I'm going to put my hand on her head of her trochanter, and then we're going to have my thumbs towards each other, and we're going to go into that vastus lateralis, which is the middle between the third between my 2 thumbs. So sometimes it helps if you have the patient flex their foot up, and that makes that muscle nice and tight. You can see where her muscles tightened up. but I would never want to give that injection in a muscle that's contracted. So I'm going to have her relax that muscle again, and so it'd be right here is where we would be giving that injection. Okay, now I'm going to have Luann turn on to her side. And for the ventral gluteal muscle, we want her to be lying on her side in a relaxed position. And I'm going to show you those landmarks too. So in this case, again, I need to find the head of that trochanter. So we're going to feel for the head of the trochanter. What I could do too is have her take her leg and just kind of bend it back and forth, and that kind of feels where that pivot point is. So with the pivot point, that's the head of the trochanter, I'm going to shift my hand around to the side, because always I need my thumb to her groin. That tells which hand I should be using. So I'm going to use my thumb to the groin. My palm is on the head of her trochanter. And then I reach my fingers up and find her iliac crest, which is right here on the top. I hook my finger onto her iliac crest, thumb to the groin, spread my fingers back, and right here is the ventral gluteal spot. So if I was too high, I would feel a bony part of her iliac crest, but because I can come down a little bit, and that's where the ventral gluteal is. And as you can see, I have a pretty long finger, so you're going to have to adjust a little bit up or down depending on the size of your hand and the patient, so that the ventral gluteal is located right there on that side. What I'm going to have you do is have Luann flip to the other side so you can see both her right and left hip to do that. So now we're going to do that same process again. We're going to have her bend her leg a little bit, and I can feel where the head of her trochanter is. Now I need to use my right hand, because I always want my thumb to her groin. So my hand is on the head of her trochanter. I reach up and find her iliac crest. I hook my finger on her iliac crest and spread my fingers back. And then I feel, is that nice and soft, or is that bony in a bony area? So if it's nice and soft, I have a good position for the ventral gluteal. So now we're going to give the Z-track injection. The Z-track injection we're going to do on actually two of the mannequins. So I'm going to find the placement again. I'm going to find the head of her trochanter right here. And you can feel that bony prominence, and it's pretty much in line with her groin. I'm going to place the heel of my hand on her head of her trochanter, reach up, and I can feel the iliac crest quite easily on this mannequin. My thumb is to the groin. I spread my fingers, and then I'm going to come and feel. If I was up here, it's hard and it isn't going to be injectable. So I'm going to pull down, and it's right here. So that's the soft area for the ventral gluteal. I'm going to take my alcohol, and now we're going to Z-track. So Z-tracking is a little different. So we're going to use this little soft pad so you can see how the Z-tracking is going to go. So I found my landmark, and I'm going to clean the spot, starting at the center, working out 2 inches. And in this case, I'm just going to leave that set there. I need to let the alcohol dry, so that will take a couple seconds for it to dry. And I'm going to get my syringe ready now. So I'm going to take the cap off. I made sure my needle is on nice and tight. I'm going to remove the cap. And now what I need to do is I need to displace her top of her subcutaneous tissue so that I can give it in a Z-track manner. So I take the lateral portion of my hand and I pull over about an inch or so that the tissue is now taut. We're going to displace that tissue, and then we're going to come down at a straight 90-degree angle into it. You're going to feel a poke, and we're going to dart, secure, and then we're going to aspirate. We're going to pull back 1 or 2 tenths. We're going to look for aspiration. There's no blood, so then we're going to give the injection slowly, 10 seconds per 1 ml. And then we're going to hold it in for 10 seconds. So 1001, 1002, 1003. And once the 10 seconds are held into it, so I pull up, let out. I activate my safety device with my syringe, or hold it until I can. I'm going to apply a little pressure onto the injection site so that if it would bleed, then we can take care of the patient. And so I could put a Band-Aid on that. The syringe itself, because I don't have a safety device onto this syringe, I need to place it right into the sharps container. And I don't want to set it down. So I'm going to take this over here into the sharps container, place it into the sharps container, and dispose of that safely. And my patient, I could put a Band-Aid on the patient if I needed to. If not, it'd be good.